Order. The question is that the motion be agreed to, and I call the honourable member for Mallee.
Thank you, Mr Deputy Speaker. When you're sick and you need a doctor, it should not be a Herculean task to get an appointment. However, doctor shortages exacerbate poor health outcomes of everyone, in particular in regional and rural towns. And I can speak for my experience in Mallee. In the 46th Parliament, I worked hard with the then Minister for Health, Greg Hunt, to work on solutions for this problem. These measures included making telehealth permanent, thanks to COVID, funding 80 Commonwealth-supported places for rural medical programs so students could study in the regions. We know that those who do, 60% will stay in the regions. We provided HECS help for nurse practitioners and doctors to have their HECS help refunded, reimbursed at the completion of time in the bush. We also incentivised the rural bulk billing incentive and increased that. We permanently retained telehealth. In the last 2 years, there have been over 100 million telehealth services delivered to more than 17 million people, with a cost of $5.1 billion. Telehealth increased access, reduced travel time, reduced risks of sitting in waiting rooms where others might have COVID, and reduced waiting times for patients in regional and rural areas to see a doctor. The previous coalition government also funded $114 million, which includes for the Commonwealth-supported places, so students can easily study medicine regionally. I recently had the pleasure of attending the Charles Sturt University's new Mallee Clinical School in Swan Hill, which will benefit under this initiative. I also advocated for this program in Mildura and worked and will continue to work with La Trobe and Monash universities to see that rural secondary school students can have a closed pipeline from Year 12 all the way through their post-grad course. I have already raised this with the new Minister for Education, Jason Clare, and will be raising this with the new Minister for Health, Mark Butler, when I meet with him. I have two concerns about the recent changes to health policy under the new government. The first is the expansion of the distribution priority areas classification system, as recently announced by the Minister for Health and Aged Care, which outlined the expansion of the DPA to modified Monash 2 areas. As we heard from the member for Dunkley, we now have the international and bonded students, medical students, can go to Frankston instead of Mildura or Oyun or Swan Hill or Horsham, regional areas that are desperate for doctors. Now they can go to Frankston. It doesn't take two guesses to work out where those doctors would prefer to be, where there are lots and lots of patients, lots of other doctors, lots of hospitals who can support them. More needs to be done, and this solution by the now Minister for Health is not a solution at all, and it will detract from the healthcare in our regional and rural areas. The member for Dunkley spoke about a patient who has to wait 5 days for an appointment. I can tell her, and I'll tell this chamber, that in my communities, people are waiting 4 weeks to see a GP. We have older doctors who are retiring, and they need to retire. One of them is my husband. We have very few new doctors coming to our regional areas. This is a huge concern, and this government will now be held to account for the policies they are putting in place. The question I have about the urgent care clinics that this government is putting in place, 50 of them, 1 in Dunkley. Well, that's excellent. Will there be 1 in Mallee at all? 83,500 square kilometres. Will there be 1? That is my question to the Minister for Health, and it's a reasonable question. A lot of patients prefer to be bulk billed, especially if there are plenty of doctors who are bulk billing. But the bulk billing fees need to increase, and urgent care clinics, great idea, need to be more than a platitude. They need to help us in regional settings. I'm concerned that despite the health inequity in my electorate, the dire need for more government funding and the fact that Mildura is in the top 50 cities in Australia by population, my electorate will not see one of these urgent care clinics.
Authorised by Anne Webster, The Nationals, Mildura.